Hi, welcome to another episode of the Just in Time Web Show. Really excited to bring to you a topic today that I know a lot of you have a lot of questions about, and that is the changes to our Medicaid program. But first of all, I've got a couple of announcements and some information I'd like to share with you. We have recently posted an excellent video, and this video is called Schools and Families, Assisting Families in Receiving Appropriate School Services for Their Child, and it's presented by Dr. Richard and Jane Horowitz. So if you will go to our website at www.jitfl.com and just check out our recently posted videos. You're going to see this and the others that we've recently posted there and get some great new training materials. Without further ado, I'd like to introduce our speaker today, and that is Diane DeMark, and we're going to be talking to you about these Medicaid changes. Welcome, Diane.
Hello, glad to be here.
Great. Well, we're so appreciative that you have some time to share this information. Would you be able to tell the viewers a little bit about yourself and what your role has been in the rollout of this new Medicaid program?
Well, first of all, I have to go back a few years. In Florida right now, there is a Medicaid child welfare prepaid mental health plan. It's a managed care plan for all the children who are in child welfare to manage the mental health services. And it's been in place for over 7 years. I am the person who birthed that program, and I've been the statewide project director for the community-based care lead agencies for that partnership with Magellan for over 7 years. In the last few years, my focus has been to make certain that as AHCA, the Agency for Healthcare Administration, has rolled out managed care for everyone who is Medicaid eligible in the state. We have been big advocates to make certain that there would be a specialty plan just for the children in child welfare. This plan covers all health care, including dental care, pharmacy, and all of the behavioral health services. So a year and a half ago, the CBCs, the community-based care lead agencies, formed a company called Community-Based Care Integrated Health. We call it CBC Integrated Health. And that company has subcontracted with Sunshine Health here in the state to compete for and we won the contract to be able to manage all healthcare services for children in child welfare. My role has expanded from the state project director to now being the vice president of CBCIH in charge of operations.
Okay, so a quick question for you on that. So Sunshine Health is going to be the provider for all the children who are currently in the foster care system, correct?
They will be, if that is the plan that is chosen. In the current child welfare prepaid mental health plan, we have an automatic enrollment into that plan. With the rollout of all eligible Medicaid recipients being in a managed care plan, the federal government has required that everyone has a choice of which plan to be in. This plan, the child welfare specialty plan, the contract for it, that was won by Sunshine. They also won contracts in 9 of the 11 regions of the state for regular Medicaid managed care plans. So they've won this plan for all the state for the kids in child welfare. Now, if a parent or a guardian chooses another plan other than this plan, then the child can be in that plan and not in the specialty plan.
So there is more than one option available for them to choose a provider for the children in their home that are currently in foster care?
They have the choice of any of the managed care companies that won a contract for their region of the state. Okay. One of those is the specialty plan. The specialty plan is a joint venture between Sunshine, who holds the contract, Senpatico, which is another managed care company, a sister company to Sunshine, and that company is managing the behavioral health services, and CBC Integrated Health. CBC Integrated Health has the role and responsibility of making certain that the CBCs, the local level, have staff and a process to be a part of coordinating all services for any child who is in this plan, who is active in child welfare, both those who are in out-of-home care and those who are in-home with their parent or parents. Anyone who is active in FSFN, which is, of course, the Florida Safe Families Network, which is the data system that has all the documentation for all services that are provided to children in child welfare. If they're active in FSFN and they're Medicaid eligible, then they can choose this plan. This plan will allow every community-based care lead agency to work with all the dependency case managers to make certain they know everything about the child that's happening as far as healthcare goes. We are going to have a system, a data system, unique to this plan that is going to incorporate all of the information in FSFN, all of the information from Sunshine on any services and diagnoses a child has, all their pharmacy information, and all their behavioral health care information in one location so that we can at all times know exactly what is happening to a child. This is a dream for this state, and it has never happened quite like this anywhere in the country.
So this, what you just described, is called the specialty plan?
Yes, this is the specialty plan. It's the Sunshine Health Child Welfare Specialty.
Okay, and so the Sunshine Health Child Welfare Specialty Plan is available throughout the state of Florida in all the regions?
Yes, in all 11 regions. It's one plan for the whole state.
Okay.
That was one of our goals, was to make sure our children move from one part of the state to another. And we wanted to make sure that there could be one comprehensive plan so that wherever the child was living, they could make certain they have the appropriate services, have the appropriate physicians, and have the appropriate care, no matter where they are in the state.
So now, if I'm a foster parent and my child was on straight Medicaid or MediPass, do I still have that as an option?
No, it is not an option anymore. What straight Medicaid, as what you call straight Medicaid, is in ACA terms fee for service, and MediPass is the other system that was in place. MediPass is going away. Mm-hmm. The new system is rolling out in over 4 months across the state. The northern part of the state is rolling out May 1st. It's going live for both the children in child welfare and all of the recipients who are in Medicaid. The June 1st will be the west coast of the state. July 1st will be the south. CMS, Children's Medical Services Managed Care Plan, will be rolling out statewide on August 1st.
Okay, well, that's a good point you bring up. So CMS, Children's Medical Service, so if I have a medical foster child, they're staying in their current CMS, or do I have to reapply and select CMS for them?
The children who are currently in CMS, if a decision is not made to pick CMS, will be auto-enrolled into the Sunshine Child Welfare Specialty Plan. This is a unique situation that just started 2 months ago. And I just want to say the goal for the children in CMS for all the community-based care lead agencies is to make certain they're in the correct plan. There's going to be some transition over this summer and making certain that we have every one of the CMS children in the correct plan. ACA is comfortable that not only the Child Welfare Specialty Plan, but all of the managed care plans will be able to provide services and cover services for children in CMS. We are going to be looking at that as we go forward across the state, and hopefully by September 1st have all of the children who are currently in some CMS. The CMS plan for the state will be rolling out in August. And when that happens, any decisions about where a child should be will be made with dependency case managers, foster parents, relatives, parents, to make certain that the best plan is chosen for the children in CMS.
So Diane, if I'm a foster parent that's just received the document that states that I need to select a provider for my child, I should be expecting a meeting with my case manager and other interested parties to help us sit down at the table or have a conversation that's going to determine, based on my child's needs, this is the correct provider I should be choosing. Is that correct?
It is correct. Our dependency case managers are going to be asking a lot of information from every one of the foster parents, relative, non-relative caregivers, about the information that's needed by the plans to make certain that we identify any child's current or former needs. And during that discussion, the discussion can be, these are the options that we have for this child. Do you have any recommendations? The letters that are going out, these enrollee letters that are going out across the state, are going out as 2 months before each area goes live. That letter may very well go to the CBC and not to the foster parent or relative, non-relative caregiver. The reason is because in the state systems that manage all of Medicaid, the address for that child, if they're in out-of-home care, is frequently the CBC's. So it is going to be the dependency case manager who will have that conversation with you. If you're not comfortable with that decision-making process, you can always contact the coordinators who are working at the CBC in the health and behavioral health areas. And they can walk through and have discussions with you about the best choice for that child.
Okay, fantastic. So I have a question, and this is going to be related to CMS and the foster child and these providers. Is there any medical situation that would basically preclude them from having one or the other provider? Like what I'm asking is, if they had like a pre-existing condition, could they possibly not get accepted by Sunshine if they were on CMS or like something like that?
No. Sunshine is going to accept any and all children who are active in FISFIN and who have Medicaid. That is the requirement, and that's certainly what they're going to do. What they're also going to do is to make certain, if a child has a specialist or a physician or a dentist or a therapist who is not in their network, they're going to work very hard to get that person or entity into the network. But the big thing to talk about is that when your area of the state has that go live date, whether it's May, June, July, or August, Sunshine is going to, for 90 days, continue paying for services, whether the provider is in their provider network or out of their provider network. They will do a continuity of care payment during that time frame.
Well, that's good to know, because one of the biggest concerns and questions I've seen come across is that the caregivers are receiving this information and they're checking with their current providers, and many of them are saying that no, they are not on Sunshine's plan. So what you're saying is, for 90 days they're going to cover whoever that provider is, and during that time frame, is there something that the foster parent should be doing to try to make sure that their current provider is getting on Sunshine's plan?
Well, there are two things you can do. First one is that you can make sure the dependency case manager knows that you've heard this person isn't on the plan, and that dependency case manager will take that information back to the CBC. Each CBC weekly gives us updates on what providers are not in the plan so that we can get that information to Sunshine. If it's a behavioral health provider, it very well may be that they don't have a contract with Sunshine, but have a contract with Simpatico. And Simpatico, as I said before, is the behavioral health managed care entity. And that will cover them with Sunshine.
So a foster parent would ask their behavioral health provider, not only do you accept Sunshine, but also if they say specifically, are you on the Simpatico network, that would cover them as well?
Yes, that's exactly right.
Good. Okay. I get it. So far, so good.
Okay. Now, the other thing that the foster parent can do, number 2, is that they can talk to the provider about whether or not they're interested in being on the network, and tell them that if that's the network that's going to be used for all the children in child welfare.
Well, I know that there are some concerns. I think probably this is the biggest concern of caregivers right now, is that that they may not be on the Sunshine Network, and the concerns of the timing with being able to get providers on, or if their provider will even be willing to get on the network, and they just don't want to go through changing, pediatricians, dentists, all of that.
Well, it's a really important point, and I can tell you that since last fall, we have been working with both Sunshine and Simpatico to identify as many of the providers who provide services to children across the state as we possibly can. We've given them many, many names, and we've worked with Simpatico and Sunshine to have time to talk to these providers if there's any questions or concerns. Sunshine and Simpatico have done a really wonderful job of turning these names around, making certain that they have contacts as quickly as possible, moving the paperwork through so that we can make certain that we have the most robust network possible for the children in child welfare.
Okay, great. And that goes for dental as well?
Yes. Dental is a unique issue. The state went to managed dental care a year and a half ago. Now, dental is a part of every one of the managed care plans. Each plan has had to determine what providers to use in the state. We have, as the child welfare plan and the CDCs, given to Sunshine list of every dentist that we use, and making certain, especially health departments where they have dental services, are a part of the network. I believe we're down to like 5 or 6 of the health departments that we still don't have contracts with, but it's a daily effort, and we're continuing to make certain that we have all the dentists in the plan.
Okay, all right, I see. Another question is, if I'm a foster parent and my child is on the Sunshine Specialty Plan, and then during the year I adopt the child, can I possibly change providers? Do I have to wait until a certain time to change providers? How does that work?
It's a good question. When a person's status changes in Medicaid, going from being active in child welfare to being still on Medicaid, but being with an adoptive parent, there will be letters sent to the adoptive parent for them to make a choice of which plan to be on. The child welfare specialty plan will no longer be a choice because it is only for children who are active in FSFN. The choices will include Sunshine, the regular Sunshine plan, in 9 of the 11 areas. The only areas of the state that do not have Sunshine as a regular managed care plan for Medicaid are in Panama City, Pensacola, and Tallahassee area. That area has other managed care plans but does not have Sunshine. Now, one of the good things about switching to the regular Sunshine plan is Sunshine has made a concerted effort to make certain that their provider networks are the same between the specialty plan and the regular plan. So if you have physicians, if you have other providers that you are comfortable with and you want to make sure that you can continue with them, the adoptive parent can choose Sunshine. If they don't choose Sunshine, there is a default plan that's listed on those letters, and that's the default that they would go into. They have 30 days to do that, by the way.
Okay, so 30 days from when they're adopted to make sure that they, if they're interested in changing providers, to get that done, or else they're going to go into whoever their default provider is that's designated.
It's actually not 30 days from the day of adoption. It's 30 days from the day they get the letter.
Okay.
It could be different depending upon when the child is no longer active.
Right. That makes sense. Okay. All right. Perfect. So if I'm an adoptive parent now and I get the letter, I understand that I'm going to get a selection of possible providers in my area. How am I going to determine which is the best provider to choose for my child?
There will be information that's sent in that letter, which tells you all of the services that each one of those providers, it's not really a provider, but a managed care company. Each one of those managed care companies has in their system. Mm-hmm. You can also go to each one of those managed care companies' websites that will be on the letter, and you can look at their provider network. Mm-hmm. You can see what providers are in their network and what providers are not in their network. So it's a time for an educated decision by each one of the adoptive parents.
Okay, all right, perfect. That's good to know. So I can see if my pediatrician and dentist is on their plan and then select maybe the best of the choices that they're already on.
Yes, definitely.
Okay, perfect. Now, another question that's come up that I think is a good one is, if I've adopted my foster child and I have insurance available through my employer, and I decide I want to go ahead and enroll them in my employer's policy with my family, then do I still keep the Medicaid?
Well, I can tell you that what I would do as an adoptive parent is do both. Keep the Medicaid and have the private insurance. Private insurance is primary and would pay, but anything that isn't paid by your private insurance and is covered by Medicaid would then be paid by Medicaid.
Okay, so then the Medicaid would just be like your secondary insurance.
Yes, it is. So one of the issues has been is that we were hopeful that we would be able to keep the children who are post-adoption in the plan, because for continuity, that they would be able to remain in the plan with their providers. That has not been approved by ACA, but we have requested that. And it may be at a later date, maybe next year, that might be a change that does happen.
Okay, great. Now, on these programs that are not through the Sunshine specialty, do they all also include behavioral health coverage, dental coverage, etc.?
All of the plans have to include the full continuum of care. The difference and the uniqueness between those plans and Sunshine's Child Welfare Specialty Plan is the unique relationship with the CDCs and the ability to have coordination of care between the child welfare system and the managed care system, and to have access to the data from both sides.
Okay. Well, I mean, that sounds fantastic. It's another layer of assistance, and to me, the more integrated it is, hopefully the easier it is for us as caregivers, right?
Absolutely, that's the plan. We don't want to have to send you paper or ask for information more than once, and then you'll be able to find out anything and everything you need to know about the child. They're still in child welfare, or they pick Sunshine's regular plan if they go out of the system. We'll be able to give lots of information to whomever has the child in any other part of the state.
Okay, perfect. Well, we're about out of time, Diane. So just, I guess, in conclusion, is there a resource or a place where we should direct people if they have further questions that maybe we didn't get the opportunity to cover here?
Well, there are a couple ways you can do that. One is that there's an 800 number special for the specialty plan. And the people answering that phone at Sunshine have all been trained and are only working on the specialty plan. We're going to be doing training, by that I mean community-based care integrated health, across the state. We're going to offer it to all the foster parent, adoptive parent organizations across the state. And we're getting a presentation approved by ACA. I have 4 regional coordinators who work with me who will be the specialists who can go out and do that in their areas of the state. I will give you their email addresses so anyone can get in contact with them about setting up times to be able to present any information that you need. They're a tremendous resource to the system and to the CDCs.
Okay, that sounds great. And we'll post them all here so everybody has access to that information. Okay, well, Diane, thank you so much for your time and this good information. And I hope that you, our caregivers that are watching, have been able to learn a lot about this. And we're going to, again, post those resources so you have further ways to connect if you have any additional questions. And we want to thank you so much for joining us on this episode of the Just in Time Web Show. We're always interested in hearing from you with comments, questions, concerns. You can always shoot us an email or post on our Facebook page, and we're going to attach those links right here. Thanks again for joining us, and have a wonderful week.